Experts warn, however, the treatment is not applicable for large populations. Researchers revealed on Tuesday that an American, described as a middle-aged woman of mixed race, has likely been cured of HIV after undergoing a new transplant procedure using donated umbilical cord blood. The patient, who needed a stem cell transplant for leukemia, reportedly developed a new HIV-resistant immune system following a breakthrough procedure in which she was genetically matched with umbilical cord stem cells that contained an HIV-resistant mutation. She was part of a study that began in 2015 designed to monitor outcomes of 25 people with HIV in the U.S., who underwent a transplant, according to the National Institute of Allergy and Infectious Diseases. Dr. Yvonne Bryson, an infectious disease physician at UCLA, who led the study, discussed their team's finding along with the patient's condition at the Conference on Retroviruses and Opportunistic Infections this week. Today, we reported the third known case of HIV remission and the first woman follow. And she would find a more difficult time finding both a genetic match and one with the HIV-resistant mutation to both cure her cancer and potentially her HIV. This is a natural, but rare mutation. Bryson added that while this approach of using genetically matched umbilical cord blood with HIV-resistant mutation opens the door to more diverse populations and studies, she confirmed there is no current routine screening in place in the U.S. for this mutatee. Previously, only 2 men have been cured of HIV using a bone marrow or stem cell transplant. And while this is the third known case, according to Bryson's team, of HIV remission in an individual who received a stem cell transplant of any kind, experts in the field caution that this method is not ideal for curing the many millions of HIV-positive people around the globe today. Bryson said there could eventually be approximately at least 50 people per year that may benefit from this. In an interview with Community Health Center Incorporated, Dr. Anthony Fauci, the leading expert in infectious disease in the U.S., whose work in HIV care and treatment innovation spans 4D. It is not practical to think that this is something that's going to be widely available, Fauci added. It's more of a proof of concept.